Happy Friday, everyone. Welcome back to Atlanta & Company. Talk to any woman with spider veins on her legs, and she'll probably tell you they are the bane of her existence. But guess what? They don't have to be. Dr. William Johnson is here to share how we can get rid of them once and for all. Welcome to the show.
Oh, thank you for having me.
Well, we're so thrilled you're here. Poor doctor. In the commercial break, I was like, all right, doc, I've had these since I was in 7th grade. I'm sure, you know, this is something that really bothers not just women, but men as well. So talk about the difference between the spider veins, a little annoying, unsightly ones, and more serious varicose veins.
Sure. Like you said, it's a very, very common problem. It affects men and women. We see it in all ages. We see it in teenagers all the way up to elderly age, and pregnancies are making it worse.
Yes.
And, you know, when you start seeing spider veins and little varicose veins popping up on your legs, it's often an underlying problem that's causing that. And a lot of times people just want to come in and just treat the little spider veins.
Right.
But if you don't look at the underlying problem, they're just going to come right back. It's like pruning the branches of a tree. They're just going to regrow.
Right,
and so what we got to do is look at the tree trunk, so to speak, of what's causing it. Why are these veins popping up on your legs? And so typically the first thing we do is get an ultrasound, and that's going to tell us, is there a problem with what's called venous reflux or venous insufficiency. That's when the blood is going the wrong direction. Valves in our veins are supposed to stop it from going that way. And if it starts going that way, that causes all the branches to start becoming enlarged, and the branches off the branches, and that's when things are popping up on your legs. And so if you just look at just the surface problem, you're missing the whole picture here. And that's what we do now as vein specialists, is try to treat the underlying problem.
Sure.
Because that's going to allow those spider veins to go away. People come and say, I've had these spider veins treated and treated, and they keep coming back.
I have too, yeah.
If you don't treat the underlying problem, they're just going to keep coming back.
Okay, and so I feel like some of the causes, heredity. I know my mom has them, my grandmother had them. Is that just one of the many causes?
Yep, family history is a big one. If your mom has it, unfortunately, you're probably going to have it too, or your father has it. Don't blame them too much, but it is one of the main risk factors. Being a woman is definitely a risk factor, but men, like I said, men make up about 30% of my patients. It's extremely common for men to get it. Jobs where you stand all day. This is a problem that I've had to deal with. I'm a surgeon. I stand in one spot every day, and it just puts pressure on those veins. Pregnancies certainly make it worse. As you get older, it gets worse.
And then we're talking and we're looking at, it's just some of the signs, symptoms. So if you're watching right now and you have any of these, and it's funny you should say men, because one of our dear friends, he had, the veins like in the first picture, the varicose, and he said, you know, it was so uncomfortable, and getting him treated, it really gives you a whole new lease on life.
It does, and I know those pictures look horrible, and you're like, my legs don't look like that. Is that when I need to start getting these veins treated? No, we want to actually start treating it earlier.
Okay.
We're all about prevention now, and so when you start to develop these symptoms is when you want to get them treated. Heaviness, tiredness, throbbing, restless legs a big one, swelling's a big one. These are things that a lot of times people chalk up to other problems. Well, I'm on my feet, my legs are supposed to hurt.
Right.
I'm standing all day, of course they're going to hurt. No, there are treatable problems with this, that if it's your veins causing this, those symptoms can go away. These treatments are office-based, under local anesthesia. You don't have to come back for follow-up. You get the treatments and you're done.
And let's talk about insurance, because I know a lot of people out there are thinking, okay, I'm going to finally go see the doctor, get this done. What's the likelihood of it being covered?
Yeah, a lot of times there's a misconception out there that this is all a cosmetic issue and insurance won't pay for it. No, insurance will actually pay for a lot of the treatments, especially those directed at that saphenous vein, which is where the venous reflux, where the original source of the problem occurs. And most all insurances cover it. We're going to get an ultrasound to see, is this a problem that shows up on the ultrasound? If it is, your insurance will pay for it.
Wonderful.
All major insurance covers this.
Good. And risks? I know you mentioned that you're up and about pretty quickly, right? So.
Yeah, I tell people, go back to work. You got plans, you want to go to the football game this weekend, you've got a concert you want to go to, you got plans, you don't have to take any time off with this. You're right back to work. It's a very, very low risk, safe, effective treatments. There's no sutures. There's not even any stitches or anything needed anymore. You just put a little Band-Aid on these little needle pokes that we have to do. It's all done under local anesthesia.
Right. It's incredible how far you've come.
It is.
With the technology.
It's not your grandmother's vein clinic anymore.
No, not at all.
So we, there's those old misconceptions about having to keep off your feet for 2 weeks and everything. None of that anymore. You're right back to your old activities.
And talking about prior treatment success, I imagine that your patients are just thrilled.
Yeah, it's an extreme. The patients are happy. And they ask, why do I do this? The patients love it. They're happy. They come back. And this is something that, unfortunately, it is a lifelong problem. You're never going to completely cure this, But if you can get your hands around the problem and get it very manageable, it's so much easier to take care of. And then you just need little minor things every 5-10 years.
Right, and I imagine that now would be the time, since we have Memorial Day coming up. I mean, go ahead, get this done now so you're feeling confident in your shorts, your swimsuit.
That's exactly right. Summer's right around the corner. We're all starting to think about the family vacations and getting in bathing suits and shorts and everything. This is the time to do it, because there is a process that we got to get. Everyone wants it all done, and
I know,
they come
right?
in and they just want to walk out with pristine legs. It's a process, but
Sure.
but we can do it quickly. We all do it within a few weeks. Our staff will help. We have wonderful staff that'll help guide you through the whole process, get you through the insurance, and you know, that's part of going to a vein specialist. You're going to get a modern look at diagnosis and treatment of these veins.
Fantastic, Dr. Johnson. Thank you so much. I'm going to come see you. I'm sick of these things. All right, for more information, as he just mentioned, it's Vein Center at johnscreek.com. And this segment was paid for by the Vein Center at Johns Creek. Thank you again. Such great information.